Hello and welcome to Force's first Hereditary Cancer Live Update. Our live updates are meant to deliver news designed to keep you informed, empowered, and engaged. The updates given today are paramount to our community. My name is Elise Boucher. I am a member of the Force community, and I will be your moderator. Force improves the lives of millions of individuals and families facing hereditary breast, ovarian, pancreatic, prostate, colorectal, and endometrial cancers. Our community includes people with a BRCA, ATM, PALB2, CHEK2, or other inherited gene mutations, and those diagnosed with Lynch syndrome. We accomplish the Force mission through our support, advocacy, education, and research efforts. Visit our website for expert-reviewed information and access to our support programs, including virtual Zoom meetings, our peer navigation matching program, and our online message boards. At this time, we would like to recognize our sponsors for making this programming possible and for their continued support of Force and the hereditary cancer community. Our Force presenters today are Lisa Schlager, Vice President of Public Policy, Diane Rose, Vice President of Research, and Kelly Owens, Director of Education and Research. After their updates, we will conduct a Q&A to answer the many questions that you have. Please submit your questions using the Q&A feature. We will do our best to address each one. Our presenters will not be providing medical advice. Please reach out to your doctor if you have any specific or urgent questions. At this time, I would like to welcome Lisa Schlager, Force Vice President of Public Policy.
Thank you, Elise, and thank you everyone for joining us today. I'm happy to kick off our first hereditary cancer update. We're very excited about our upcoming Federal Advocacy Day. This will be our fourth year having a federal advocacy event, and we hope you can join us. It will be a virtual event, so all of the meetings are conducted by Zoom. Very easy for anyone to participate from the comfort of their home or office. And it will be taking place on June 12th, generally between the hours of 10 and 5 Eastern Time, but those hours will be slightly adjusted for people in other time zones. You don't need any experience. We're offering virtual training. We have two options for you to choose from. And for people who have not done an advocacy day in the past, you won't be alone. You'll be teamed up with other members of the community, other survivors, previvors, thrivers, healthcare providers, etc., so that you each offer your unique perspectives in the meetings with the federal lawmakers, which would include your two senators as well as your representative. Generally, the meetings will last about 30 minutes, but sometimes they're a little shorter. And it will give you an opportunity to talk about some key issues that are important to our community. So you can see the link here, and on the next slide, we have information where you can scan the QR code if that's easier for you, or again, that web link URL. And as you can see, virtual, very easy. Again, we hope you will join us. If you have any questions or concerns, feel free to reach out. And we do have a $25 registration fee. This helps offset our costs. If for some reason that poses a challenge for you, we do offer scholarships and complimentary registrations, so don't hesitate to reach out. And now we're going to move on to some of our state advocacy work. In recent years, Force has gotten heavily involved in state public policy efforts. This is a great chance for us to make an impact on a state-by-state basis on issues that are of importance to our community. As you can see here, these are just some of the issues that we are engaged in, and we've had already in 2025 some fabulous successes. We've passed new laws that will be taking effect typically at the beginning of the next calendar year around high-risk prostate screening, ensuring they'll be covered with zero out-of-pocket cost, as well as high-risk breast screenings and diagnostic imaging, also with no cost to the patient. We're excited to see genetic counselor licensure becoming a law in Mississippi. And then bigger picture, we are now looking at passing laws in states that will cover multi-gene panel genetic testing as well as all of the recommended high-risk cancer screenings. So this is sort of our dream scenario, and we're really excited that Arkansas passed that particular law this year. We've also seen a lot of action in legislation around fertility services and fertility preservation. Thus far, Georgia and Virginia have passed bills. And we expect over the next few months, we will have a few more successes, so we'll keep you updated at our next webinar. I want to note that we also are involved in some other issues, including step therapy and patient navigation. We just saw passage of a new law in Montana that limits step therapy practices, which is a big concern for people with cancer and those with other chronic conditions. So, very exciting. I hope you'll celebrate with us with these successes. And for those who are looking for ways to help and get engaged, we do have an advocacy action center. It has legislative activity around some of the federal bills that we are tracking, and it'll offer you pre-written, customizable emails that you can easily send to your senators and House representative. You can go to this web address that's shown, or that QR code there will take you to the Advocacy Action Center. We also always like to have volunteers. We have a patient advocate leaders program. Our patient advocate leaders get training, virtual training, and then they help us, especially with our state advocacy efforts in the states in which they reside, but also with some of the federal efforts as things arise. If you have any interest in that, please go check out our webpage and you can apply and we can give you more information. Many of our pals have been instrumental to passage of some of those bills that are now becoming laws in the states that we've been active in this year. So thank you to our patient advocate leaders, and thank you for listening to our policy update. I'll pass it back to Elise now.
Thank you very much, Lisa. Next, I would like to welcome Diane Rose, Force Vice President of Research.
Thanks, Elise. I'm excited to present our research updates, and today we're going to be talking about hereditary prostate cancer and why it matters. Prostate cancer is a key part of the hereditary cancer conversation, yet many men who carry a genetic mutation are really unaware of their increased risk. And research shows that men with certain inherited mutations have a higher lifetime risk for prostate cancer. And they also may be more likely to develop aggressive forms of prostate cancer with a higher risk of metastatic disease. And because of this, there are screening guidelines that exist for men with a family history or known genetic mutation. And the goal is earlier detection and then better outcomes. The National Comprehensive Cancer Network, or NCCN, has guidelines for screening using PSA tests and digital rectal exams in people aged 40 and older who are at increased risk for prostate cancer. So if you have a BRCA2 mutation, NCCN recommends yearly screening. NCCN also recommends other high-risk people should consider annual screening after they have a conversation with their doctor about the benefits and the risks of testing. And this would include people who have a mutation in another gene that's linked to prostate cancer, if they have a family history of prostate cancer, and if they are Black or African American. Genetic testing doesn't just inform the risk, it can also guide the treatment. So men with hereditary prostate cancer may benefit from targeted therapies like PARP inhibitors and have access to clinical trials that are exploring new treatment strategies. By highlighting prostate cancer in the hereditary cancer space, we can improve awareness, promote early detection, and expand treatment options for this community. High-risk people should consider enrolling in a screening clinical trial. Force's featured research page and our research search tool focus specifically on research studies that are enrolling patients with or at high risk for hereditary cancer. We have studies on our website for treatment, prevention, detection, and risk, quality of life, and surveys, interviews, and registries. Today, I'm going to be highlighting two screening clinical trials. The PATROL study is an early detection screening study. Study procedures to participate include an annual clinic visit, a PSA blood test, and prostate imaging that would be discussed and directed by your doctor. At each annual patrol visit, participants will be asked to fill out a survey, and blood and urine samples will be collected for the patrol biorepository. The annual visits and collections will be conducted for about 10 years after you enroll in that study. The National Cancer Institute, or NCI, opened a clinical trial for prostate cancer screening in men who are at high risk for prostate cancer due to an inherited mutation. And this study includes screening MRI of the prostate every 2 years, an annual PSA blood test, and a biopsy of the prostate if any of the MRIs are abnormal. And please note for this study, there are no costs for the study-related tests or procedures, and also no costs for travel. And the clinical information from this study will be shared with you. And if you choose, you can also have it shared with your doctor. Shown here on the screen is the QR code to take you to the screening studies on our website. We have 3 prostate cancer treatment studies that I want to highlight today. The Neptune study is for men who are newly diagnosed with localized prostate cancer, and it is studying a new treatment approach. The treatment includes a PARP inhibitor, which will be given prior to surgery with the goal of increasing the effectiveness of surgery and reducing the risk of recurrence. Participation in the study is expected to be about 3 years. People enrolled in this study will get an oral medication known as olaparib and hormonal therapy for up to 6 months, followed by surgery to remove the prostate. Pfizer has clinical trials for metastatic prostate cancer. The MEVPRO program is conducting a series of clinical trials to find out if a study medication called mevrometostat is safe and works to slow down or stop the growth of metastatic prostate cancer. All the study participants will receive the standard of care treatment either alone or along with the study medication, which will be taken orally twice a day. And PROMISE is a nationwide registry of prostate cancer patients with inherited gene mutations. The PROMISE team is studying how these germline mutations affect treatment options and patient outcomes. PROMISE researchers hope to help patients learn more about their disease, the treatments that they may benefit from, and then any research studies that they might be eligible for. PROMISE is completely free, and participants don't have to leave their current healthcare provider or really their house to join. Shown here is the QR code for the treatment studies and registries on our website. And this concludes our research updates. Thanks.
Thank you, Diane. And finally, I would like to welcome Kelly Owens, Force Director of Education and Research.
Thank you, Elise. Today, I'd like to tell you a bit about recent material from our X-ray program. Our X-ray program is a collection of reviews that we have written to summarize in plain language research about cancer and hereditary cancer that's come out in the last year. The topics that we cover range from genetic screening, cancer treatment, and is aimed to cover issues for providers, survivors, metastatic cancer patients, caregivers, and their families. We focus on providing actionable information, giving you questions to ask your doctor about this material, highlighting national guidelines and other resources that would be useful. So each X-ray is evaluated by external scientific advisors for scientific accuracy. And the QR code that you see in the upper portion of the slide will take you to our full library of X-rays. I encourage you to check those out. But today I want to highlight 3 particular reviews that have come out recently. One is about ovarian cancer, and this particular study looks at the risk of peritoneal cancer and shows that it's low for people with inherited BRCA mutations, either BRCA1 or 2, after surgery. So peritoneal cancer is cancer that occurs in the lining of the abdomen, and the current thought is most of that is due to migration of cells from the ovaries or fallopian tubes. So having surgery as a prevention for ovarian cancer really reduces that risk greatly. The second excerpt review that I want to tell you about looks at the impact of having BRCA1 or 2 mutations on the sexual well-being of women who are at risk for breast cancer. And the study looked at women both who were diagnosed with breast cancer as well as before a diagnosis, and found that sexual well-being was impacted by cancer diagnosis, if that had occurred, and by menopausal status, but that having a BRCA mutation by itself did not impact sexual well-being. And the last review that I want to tell you about is looking at prostate cancer, and in particular, looking at how neighborhood impacts prostate cancer risk in men of West African ancestry. And this review showed that men coming from areas with high deprivation, as defined by looking at households in poverty and unemployment and other aspects that define that, that neighborhood had a large impact on prostate cancer risk for these individuals, in addition to having West African ancestry. So there's an interaction between environment and genetics in this situation that can help inform individuals about what their risk is. And then lastly, I want to highlight that all of our reviews are also translated into Spanish. And these are done for all the cancers that we cover, which are listed here, as well as for hereditary cancer in general. The QR code at the bottom will take you to those. So if you prefer to get material in Spanish, or if you know of friends or family or others in your life that would benefit from this material, please, I encourage them to check this out. And that concludes the education update for today. Thank you.
Excellent. Thank you. Thank you to all of our 4 speakers. At this time, I would ask that they please come on camera for the Q&A portion of our update. Please take the time to submit your questions using the Q&A function on your screen so that you can actively participate. We will try to get to all of your questions today. The first one we had is coming in, and it is for you, Lisa, and it is, what legislation or topics will be the focus of the June 12th Federal Advocacy Day?
Thank you. Great question. Obviously, there are a lot of potential things that we could discuss with lawmakers these days, but we have zeroed in on a couple key things. One will be the Patent Eligibility Restoration Act, or PARA. And this particular piece of legislation is concerning because it would basically reform the US patent system and overturn or abrogate prior case law. And that means that things like the Supreme Court ruling on gene patents would in fact go away. And it would allow for the patenting of products of nature and things like genetic mutations or biomarkers. We think this is a very bad thing for the patient community. Ultimately, will probably increase prices and reduce access. So we want to make sure that we educate lawmakers about the potential impacts of that. The other bills that we're going to be looking at will be focused on access to affordable supplemental or high-risk cancer screenings, specifically the Access to Breast Cancer Diagnosis Act, or ABCD Act, and the Find It Early Act. Both bills aim to eliminate the out-of-pocket costs for supplemental or high-risk breast screenings, as well as diagnostic imaging. And so we think this is a very important piece of legislation, or they both are important bills for our community, and we're excited to advocate for passage of those. So that's going to be the key focus for this year. We will also talk about access to genetic counselors and Medicare coverage of hereditary cancer services, but those bills have not been introduced yet.
Excellent. Thank you for elaborating on those topics, Lisa. And remember, go back into the presentation and you will find the QR codes and the links to register for Advocacy Day. This next question that we had come in was for you, Diane, and it is what specific family history components are most relevant when assessing risk for hereditary prostate cancer?
Yeah, that's a great question. So we think about factors that influence that, and that would be if you or any of your family members has a diagnosis of prostate cancer, especially if it's an early age diagnosis. So we consider that under the age of 55, or if anybody has been diagnosed with metastatic prostate cancer. And then race is another factor. So, Black people have the highest risk for prostate cancer out of any group. And then, of course, the presence of any inherited mutation. And then if you have a personal or family history of cancer.
Okay, excellent. Thank you for providing those guidelines. We're going to transition to peritoneal cancer. And Kelly, this question is for you. What is the risk of peritoneal cancer after risk-reducing surgery? Is there any risk? And how does this risk after surgery compare to the risk before surgery for a person with an inherited mutation or risk in the general population in someone without an inherited mutation?
Okay. Um, so peritoneal risk still remains after surgery. It is much lower. And that's what the surgery is really designed to do, is to lower that risk for, say, an individual with a BRCA1 mutation. That risk starts at about 40 to 60% across their lifetime. And after this risk reducing surgery, the risk of peritoneal cancer, kind of a residual cancer risk, um, would be around 0.1%. So a little under 0.1% for people with BRCA2, a little over 0.1% for people with BRCA1, but quite a bit lower than their original risk, and a lot lower also from the risk of individuals for ovarian cancer who don't have a mutation. So below the general population risk. So it really has a dramatic effect. It is thought, though, that some of that residual risk comes from cells that might have um, moved away from the ovaries or fallopian tubes before the surgery happened. And so there is some remaining risk. It's not none, and it's important to report symptoms if people have them.
Excellent. Thank you for answering that question completely. There were a lot of parts there, but you dove into each scenario, so we appreciate it. Lisa, we're getting a lot of questions, a lot more policy questions coming in. This one specifically is asking, why is force engaged in state policy efforts instead of focusing on issues at the federal level?
Well, to be honest, we are focusing on both. However, as we have seen in recent years, it is very challenging to pass federal legislation. And while we're working at the federal level to get bills that passed that represent the needs of our community, we can make incremental impact at the state level. And we've seen some, as I presented earlier, some tremendous successes at the state level. And so even if it's state by state, that still means that a majority of our constituents in that state with certain types of insurance will benefit from our efforts there. And so we'd rather see incremental step-by-step progress than no progress at all. So that's part of the reason we've invested so heavily in our state policy efforts in recent years. And we will continue to do so until there's not a need for it anymore.
Excellent. Thank you. Progress is paramount. So we appreciate all that you're doing here on the ground for us. This isn't a question, but a statement that came through that I'm actually going to pair with a question for you, Diane. One of our attendees just would like to say that he is a BRCA2 positive man, and he would like to thank the panel so much for taking time to discuss prostate cancer. And then there was a follow-up question with that. If I carry a genetic mutation but haven't had cancer, should I be screened for prostate cancer, and when should I start?
Oh, that's a great question. So yes, men with certain inherited mutations, especially BRCA1, BRCA2, and HOXA13, are at increased risk for developing prostate cancer, most often at a younger age, and usually have the cancer has more aggressive features. So for BRCA2, typically advise to start the PSA screening at age 40 or earlier if there's a family history of prostate cancer. For BRCA1 mutation carriers, men with a strong family history. You should really talk with your healthcare provider about when your screening should start, but that should also start around age 40. And then you can develop that individualized screening plan as recommended with your doctor and your healthcare team. And then the screenings usually include the PSA testing and sometimes the digital rectal exam. So again, it's really important to talk with your healthcare team and see what's appropriate for you with your family history and your specific mutation.
Thank you very much, Diane, for providing that framework and structure for us. Kelly, this question is kind of in the same vein as the last one because we're asking about a specific population. How does the risk of prostate cancer for men of West African ancestry compare to other groups? What underlies neighborhood risk, and what does this mean?
Um, okay. For prostate cancer, men of West African descent have about a twofold increased risk of prostate cancer being diagnosed compared to other men in neighborhoods of deprivation. And again, those are neighborhoods with high poverty rates, high unemployment, a lot of other features that we associate with challenges in a neighborhood. When you compare men from West African ancestry who are in neighborhoods with low or moderate deprivation, so neighborhoods where their situation is a bit better off, there's about an 80% reduction in their risk of prostate cancer. So there's a real interaction between neighborhood impacts and their ancestry, and that's not necessarily seen in other populations. So they're particularly subject to this interaction. Why neighborhoods have this impact isn't really known. What's been suggested by the authors of this study are their impacts perhaps by stress or lifestyle factors like diet or issues like environmental exposure, either workplace exposure or other environment issues. We don't really know exactly why, but I think it's important to really understand what might be impacting things for people and what their risk might be. So,
excellent. Thank you. Thank you for elaborating on the community factors that are a key piece of the puzzle. It looks like we have time for about one more question. As mentioned, Lisa, a lot of questions about advocacy and the issues at hand. This last question is, where can I find information about Force's current advocacy initiatives? Oh, and Lisa, I'm just going to ask you to unmute real quick.
Yes, unmuting always helps. Good question. I appreciate the question because that means you're hoping to get involved. So if you go to the Force website, you'll see across the top there are some tabs, and you'll see the Support and Public Policy tab. And when you click on that, down the left side, there'll be a few options. And if you choose the public policy link, you'll be given the choices of federal policy initiatives, state policy initiatives, and there's also a Get Involved link. Under Get Involved, you'll find things about like the PALS, the Patient Advocate Leaders Program, our Advocacy Day, as well as how to get to our Advocacy Action Center. But then, of course, we do give updates around our state initiatives. We update that information regularly as things progress throughout the sessions in the state level. And then at the federal level, that content tends to be a little more static, but you can also see information about some of our state work there. So we appreciate you visiting and looking into how you can get involved.
Okay, great. Well, thank you so much, panelists and four speakers. That is going to conclude our Q&A portion of the presentation. This presentation has been recorded and will be uploaded to our website if you would like to share or watch again. This is, again, a perfect time for us to thank our sponsors for helping to bring this programming to you. We have a number of exciting upcoming events. We will host our first Ask the Expert webinar on prostate cancer genetics on June 25th at 6 p.m. Eastern Time. And our next hereditary cancer update will be held on July 22nd at 2 p.m. Eastern Time. So if you liked joining today. If you want to share information about the next update and our first Ask the Expert, please do that. You can register for either of those events using these QR codes and also visit our website for more information.
And Elise, I'd like to jump in and just mention that specifically for public policy, we want to thank our sponsors that focus on public policy. So that would be Novartis and Johnson & Johnson. We appreciate their support.
Excellent. Thank you. Um, at this time, we just want to enforce you to please continue to reach out to Force for your support and information needs. Remember, while there are many mutations and many cancers, there is just one community, the Force community, that supports anyone who is impacted by them. Thank you very much to everyone for attending, and have a good day.